lighting a way to a cure, is lighting a way for hope. Hope.
Aloha! This is Sky with Rare Disease Hawaii. How are you doing today? I hope it's good. Now we're going to deal with a rare form of Fanconi anemia today. We call it FA, and we have somebody special with us today. Her name is Emily, and we have her very special mom, Trisha, with us. And we're going to be talking about her in FA. But for right now, I'm going to let you know what is Rare Disease Hawaii about. It's about taking care of rare disease. And what is a rare disease? A rare disease is an orphan disease in the United States that affects less than 200,000 people. And in the United States, there's approximately 7,000 rare diseases according to the National Institute of Health. And out of 30 million Americans in the U.S., 1 in 10 have a rare disease. So there's approximately, to the last population count of Hawaii, 1.43 million people. So 1 in 10 of those have a rare disease. That's a lot of rareness going on. And what is Rare Disease Hawaii about? Well, we're a patient advocacy care group in Hawaii that helps those with outreach for their rare disease to find diagnosis, to reach a diagnosis, or take care of a diagnosis that they have just got, or looking for a clinical trial or help. That's what the outreach is about. So we're laying the foundation for a rare disease advisory board to impact the patient and caregivers to empower themselves to be stronger advocates for their own rare disease. So we're an outreach resource for the rare disease community. And we do have rare disease support groups every first and third Saturday at Hawaii's State Library, right in the front outside. We gather there and then we go on from there. So hopefully we can see you first or third Saturday at the Hawaii State Library at 1 o'clock. That's when we have it. So today I would like to mention, every show I like to mention one rare group that will help you to move on to your next step in finding your diagnosis or getting answers for your rare disease. And today, that is the Every Life Foundation. I'm going to talk about that a little bit. When you have a child that gets sick and you hope there will be a treatment available, there's a foundation like Every Life Foundation for Rare Disease that is there to help you. They believe no disease is too rare to deserve a treatment. They believe all new drugs for rare diseases should be safe and effective, and they are willing to do what they can with science to help you. So if you're looking for answers, please contact Rare Disease Foundation. everylifefoundation.org. So we're going to get right into our show today with Emily's FA. Now, we have Emily and Trisha here today. Aloha, Emily and Trisha. I'm glad you're here. And I want to know, what is FA? What does that mean?
Well, Fanconi anemia is an extremely rare blood disease. Well, it's it affects all parts of Emily's body. Mm-hmm. But the primary disease, or primary function it's a blood disease, so it causes leukemia, it causes breast cancer, ovarian cancer, oral cancers, all at a very young age. Leukemia is the first cancer that happens, and it averages about age 7 to 10.
Age 7 to 10.
And Emily is 8.
And
so
8.
We watch her very closely.
Okay, because she's right at that cusp.
She is.
Because she's 7 right now.
No, she just turned 8.
She just turned 8?
Yes.
Awesome. 8 is great. I know.
Yes.
My sister's 10.
Your sister's 10. And your sister's name is?
Erin.
Erin. We wish you were here, Erin. So let's talk about FA. How is it diagnosed? How did you find out about it, and what's the genetic component to it?
So I was pregnant. We were stationed in Okinawa, and something was wrong. Something felt wrong. So they watched me very closely, and at the big 20-week ultrasound, they realized Emily wasn't growing. And she had something called an IGUR, where her umbilical cord only had one artery, and so it was like she was being malnourished. So they did an amniocentesis on me, checked her for 200 different diseases, syndromes, everything. Nothing came about. So 34 weeks came along, and she was in distress, and they did an emergency C-section, and they realized she had a horseshoe kidney, and it's in her pelvis. It's not even, it's all the way down in her pelvis. She was missing her left thumb, and she had...
and how premature were you?
She was 34 weeks. So she was
34
3
weeks.
pounds, 1 ounce when she was born, and only 15 centimeters long, or 15 inches long, sorry.
That's your average preemie size, yeah.
Right. But she wouldn't grow. Even, that's the reason they pulled her out, was she wasn't growing. They thought but she didn't grow for a whole week. Nothing grew. Her head didn't grow. Her body didn't grow. And it was pretty scary. She actually hemorrhaged at 36 hours and almost died. There were a lot of little things wrong
glad you're here.
that they couldn't really figure out why. And at about a month old, Dr. Shoemaker went, I remember something on my medical exam, and he goes, I think she has Fanconi anemia. So they pulled my husband and I in, cracked open a book.
Now, where was this at? Which
This was in
hospital?
Okinawa.
This is in Okinawa where they found that.
Yeah, Camp
And-
Lester.
And
Okinawa.
that's the doctor. We have to give him kudos for wanting to break out the books and take the time to research
Yes,
that
she
for
was.
you.
She was originally diagnosed with Vactral Association.
Uh-huh.
I don't know if you've heard
Like-
of that.
But somewhat, I'm familiar with it. It's another genetic based disease.
Really,
right?
it's actually what it is an acronym,
Ah.
and a lot of different
set us straight,
diseases.
yeah.
A lot of different diseases have kids that are labeled with Vactral Association first, and it's kind of a clue that something is going on. Really, it's the doctor's way of saying, oh, there's something wrong with the vertebrae. There's something wrong with the heart. There's something wrong, and it's like a little checklist.
right,
And if you have 3 out of 5, something they'll give her the official label,
Right.
Vactral.
So a lot of people are misdiagnosed the first time around, and you got to wait to get a better diagnosis. Like before I was found with FEO, all my symptoms, they
Yeah.
were diagnosing those as being what the problem was, even though
Right.
those were the symptoms.
Right. She was anemic. That was one clue. She needed a blood transfusion. And it's a little deceiving, but it's Fanconi anemia. So a lot of people think she's just anemic.
Right.
And that's only a fraction of what it really is.
Ah.
Fanconi anemia affects her kidneys, her liver. A lot of children are blind. They're deaf. They have a trach. They are extremely small size. I mean, Emily is 8, but she's the size of a 5-year-old.
Well, you're the cutest little 5-year-old there is for 8. So when you had the Fanconi and you finally got that diagnosis, how long did you have the other diagnosis before you got the Fanconi?
They labeled her at a month old with Vactrol. Then they said, look, we think it's Fanconi anemia, but they couldn't do the test in Japan. They
Right.
had to send us back to the United States, and that's when we came to Hawaii. We came in 2008 when she was about 5 months old, and her hematologist originally thought, I don't think it's Fanconi anemia. I think it's a different disease. But they did the test, and
It came
back positive for Fanconi anemia. And I was quite shocked. They told us don't go home and Google it. My husband went home.
Who cannot resist that? You want to learn.
And it
you
is
wanna
the
find
worst thing you
out.
can do when you're diagnosed with something so rare, because there's
Right.
very little literature out there.
Exactly.
And most of it is very outdated. And so you see the worst. And
That's why it's good to go to websites like Every Life Foundation, because you can literally call them
yeah.
and they have a direct line to what's
Right.
going
Well,
on.
we were in Okinawa, so it was a little
Yeah.
little more difficult.
It's hard to
But
find those
we did
resources
find-
out there.
Yeah, it is. We did find the Fanconi Anemia Research Fund, and that
Ooh.
changed everything.
Yay!
It careful, Emily. It's an organization that was founded by a family that had three of their daughters with Fanconi anemia. So they know exactly what we were going through. And
So she's the only known case here in Hawaii.
she is one of 3 that we know of. There are
One
2
of 3.
adults,
Okay.
which is a miracle, and Emily's the only child. She, when we first got here, there was another little girl that had it and was also military. So that was kind of fun to have another mom that totally understood
Yeah.
what it's like.
And in the military too, though. So that was
Very rare.
totally coincidental. Yeah.
Yes.
Awesome.
Small world
Yeah.
with a very small disease. So Fanconi anemia affects less than 500 in the United States,
Yeah.
3,000 worldwide.
Because we know when it comes to rare genetic diseases
Sit down, Emily.
that 10 to 15% are genetically inherited by a parent.
Fanconi
So-
anemia is recessive genetic. So
Right.
both of us were carriers of Fanconi anemia. We had never heard of it before. My husband's side of the family had, I think, some breast cancer, and my side of the family had aplastic anemia. And but we had never heard of Fanconi
So
anemia.
you never know what you're harboring until it comes out.
It takes 2 carriers to make a baby that has FA, and it's a
Wow.
25%
Wow.
chance every pregnancy,
25%
that
chance.
she'll
That's
have
a big
it,
chance.
or 50% that they will be a carrier of it.
Wow.
So her sister is very, very blessed and is that rare 25% that is not a carrier. And
Okay.
so she won't pass it along to her children.
So she just had a procedure recently.
You wouldn't know it.
You would never know it. Children are super resilient. They're way better than any of us adults when it comes to pain management. So
Emily, do you want to say what?
you want to say what you just happened? What did you do the other day? What went on?
What did you have done
I have done lots of work in my.
at school? But what did you do at the hospital 2 days ago?
I did my bone marrow biopsy, and it was really fun because I brought some stuffed animals, and we brought a game. It was called Una.
We played Uno. How many biopsies have you had? Do you know?
10.
10 bone marrow biopsies, 1 liver biopsy, and an anal biopsy.
Oh, 2.
Wow.
Yes.
2 of those. That's a lot.
A lot of
She
biopsies.
said 1.
Oh, just one.
And why did you get this?
Because you brought it for me, Mom.
Well, why did I bring it for you? What did you
Because I
do?
was being brave, and I didn't even cry from my shot.
First time ever They had to try 2 different veins, didn't even cry once.
Oh my goodness. And I'm like, give me the best person you got. I'm ready to cry now. You are awesome for not crying. And what is the name of your octopus?
Hermione.
Where is that from? What character is that?
This is from Harry Potter.
Harry Potter. Oh, that's a great name for an octopus. Yeah. So you're going to take that octopus with you this summer because school is out. And let's talk
Tomorrow.
about support for your disease. There's great things you can do, right? Where are you going this summer?
We're going to Camp Sunshine.
Camp Sunshine. And it's all going to be people with FA, just like you, right? About 65 great kids with this opportunity.
It's not just kids, it's 64 or 65 families.
Families.
It's
more than just, wow.
Yeah, Camp Sunshine.
That's awesome.
I used to be in the toddler, but now I'm in the game room.
Wow. So you get to do the grown-up good stuff now.
I get to be in the game room. Yay!
Which means you get to go to the swimming pool. And
So these are 65 families, and this is done in
in Maine,
Maine.
Pasco, Maine.
Oh.
It's an incredible place. We went there the first time when Emily was a year old after diagnosis, and Fanconi Anemia Research Fund sponsored our family and paid for our first trip to Camp Sunshine. And it was the first time I had hope.
Sounds very hopeful.
When you are told
Very
that
good.
your child won't live a very long life, it's really hard to picture anything. And she was a year old. All I could do, I cried every night for a year at
I know.
diagnosis.
I
Every
can
night.
imagine.
Every night I held her and fed her. It was hard to imagine
I
that she
know.
was sick. But Camp Sunshine, I suddenly met adults.
See, there you go. You
That-
have other people you can relate to finally.
Yes.
And there's a counselor named Emily. Spelled the same way as mine.
Wow.
Emily.
See, you get to meet other people with Fanconi, and you get to have anemia and have fun with them. Thanks for correcting me. And you enjoy having fun with the other kids, yeah?
Yeah, the kids get to just be kids, and they're whisked away, spoiled rotten by a lot of wonderful volunteers from all over. And the parents, we get to go to kind of an auditorium where we are educated with doctors from around the world that's what they specialize
So
in.
you get to work on it, you get to learn about it. Are they working on any orphan medications or FDA approved?
Fanconi anemia, it's a little different that way. They're doing a lot of gene therapy, and they're trying to fix the gene. They don't
Fix
have
the
any
gene.
medicine that's going to take it away. Right now, we just do regular blood draws. We work on the endocrine. She has endocrine issues. We work on making sure her kidneys are functioning well, her liver's functioning well. A lot of that is just watching her. Regular blood draws, the bone marrow biopsies to check for any chromosome changes.
Do you feel diet and wellness plays a major part in her recovery, or
I think
watching
so.
out for
There's
her?
a lot of talk about aldehydes and aldehydes in different foods that can cause cancer. And that's something that I'm looking forward to. They've done a lot more research since I was at camp in 2013.
So what is one food that, let's give the people an example, that would have a lot of that in there?
Anything with preservatives too, I think.
Preservatives, processed food.
Yeah, and unfortunately,
So she has to stay
we're
away
eating
from the
it right now.
processed foods. That's not cancer's best friend, let me tell you right now. And there are 350 million people worldwide suffering from approximately 7 million rare disease. And 50% of those are children. And out of those, only 500 have a FDA approved treatment. And so, like the treatment she has, they're working on finding better treatments.
Well, the first treatment we can do is a bone marrow transplant. That'll cure the bone marrow aspect of it, but it doesn't cure the disease. It's in every cell of her body. So
What is it that you can do to help her
I have to keep
stop
her,
the progression
I
of
have
her
to keep her
disease?
away from as many carcinogens as I can. It's challenging being in
Name a
Hawaii.
carcinogen for me.
When you gas up the car, the fumes from the
Right,
gas,
right.
cigarette smoke.
Cigarettes.
That's a big no-no.
Vapes.
Yeah, anything like that.
You love
The
clean, fresh
sunshine.
air. Yeah,
The
Emily.
sunshine, I even have, the radiation that comes from the sun.
Oh, wow.
She has a 400% chance of getting cancer over and over and over again. So she's kind of like a little ticking time bomb. Cancer will come, and it's just wondering, what is that trigger going to be?
Yeah, yeah.
So-
It's just a matter of
But you're strong, right, kiddo?
yeah. Of course she is. She is happy and healthy. You would never tell by just looking at her having fun, I'm telling you.
This is
And
the
you
healthiest
wouldn't-
year she's had.
And you don't even notice anything. So she was born with a small deformity. What was
A couple
that?
deformities. One, she was missing well, actually, she had a thumb. It was it was dangling, and
Looks just like a regular hand to me.
yeah. So what they did was, she was born
Same.
with a normal-looking hand, and when she was just
Looks
about
just
2
like
years
mine.
old, we went to the Seattle Children's Hospital for something called a pollicization. That's where they take her pointer finger and make it into a thumb. And it was a 5.5-hour-long surgery to make it happen.
Wow.
But it works beautifully.
Yes.
Kids with FA, often they're missing the big muscle that supports the thumbs.
Oh,
So
yeah. That's an important muscle to
very
get that
important
pen
for
writing.
writing. And she's adapted her own style. She gets tired. Her hand will cramp.
But you got your own special way of writing, right? You're used to it.
And she has an IEP, an individual education plan, that gives her a little more time to do assignments. It gives her breaks. In the past, she's gotten a lot better because she's been healthier this year, but she used to fall asleep at the desk. She'd just get so tired, and that hasn't been the case this last
She
little
looks
while.
like she's got total energy. Yeah, total energy. So let's talk about what's your expectations. We know what the prospects are. We know what the end result will be. But what's your expectations for her right now?
To be a normal kid. My job is just to allow Emily, within safe reasons, to try different sports, to just be a regular kid.
And that leads to this question. What does rare mean to you, Tricia, when it comes to Fanconi anemia? What does rare mean to you?
It means challenges. It means FA has caused a lot of heartache, but it's also allowed me to truly appreciate life because Emily does. Emily is the most positive person I know, and loves life and has goals and wants to grow up and do good things and big things, and that's what rare means to me.
Yeah. Rare is a special thing, and it does make special people out of us, It shows us the challenges we didn't think we could handle now.
Oh,
now
absolutely.
you can.
You don't realize how strong you can be when you need to be.
Right.
And, having my girls and, my husband and I, there are times where you have your pity party and you feel like the worst
But Emily ain't got time for pity parties. She's ready to have fun, right?
Right. I think the hardest part is, as a mom, is watching her go through so much, and I can't take that away.
Yeah, well, as a mom, you're a sponge. You soak a lot of that in.
Yeah.
As moms, we do, and as caregivers, we do too.
Yes.
Yes, I do. What does rare mean to you, Emily?
Rare means it means like sometimes I kind of get a little nervous because it's rare, like, and like something.
That nobody has?
So you get a little nervous, but you realize when you go to places like Camp Sunshine, it makes you realize that you're special. Right. So how can people, if they think that they have FA, Fanconi Anemia, how can they get in touch or have a support group in regards to that?
We have a support group with the Fanconi Anemia Research Fund on Facebook.
Oh, awesome.
And
the best place to be.
Oh, my
We
gosh.
have Rare Disease Hawaii on Facebook, too.
Yeah, it's probably the best thing that was ever invented for a rare disease,
I
because
know, right?
when there's no one there to talk to, I tell you, if there's any question I have about Emily, someone has been there and done that.
Right.
And around the world, someone's online.
So they can contact the Facebook.
Yes.
There's all kinds of Fanconi Anemia information on YouTube that you can contact also.
And Fanconi.org is a wonderful website.
We'll have that information up at the end of our show. And we want to thank everyone today for coming out. And thank you, Emily.
You're welcome.
And thank you, Tricia, for being here and sharing today.
Oh, we have a bone marrow drive still on for Emily.
Oh, yes,
So-
Emily's Drive. We can check that out and check it at the end of our show. We'll give information about her drive because your drive is special and you want to do great things to help find a cure, right?
Yep.
And a bone marrow donor also. So if you feel like you would like to give and donate, please contact us and Tricia, and we'll put you in contact and see your availability on checking and seeing if you're a positive match. So that would be awesome if you could help create that and make it happen. And we want to thank you for watching today. We appreciate you. Please check out our websites, our Facebooks, and let us know what you think. Thanks again for being here today. Mahalo nui loa.
But demand more, 'cause there's no finish line until we find a cure.